you. It's great to be here, and especially to be a part of your orientation day. I realize that this is the start of a very exciting journey for you all, and I'm so glad to be a part of it, and especially to be speaking on this topic of doctor-patient communications, because it really is a big deal to your careers. It will really help you to advance all the outcomes that you hope to have as a doctor. And at the core of what we're going to be talking about is the knowledge that we have that thoughts and feelings are all very interrelated to our physical health, because all the medical information that you have actually needs a relevant context so that you can facilitate accurate diagnosis more quickly, you can counsel appropriately, you can give therapeutic instructions, and you can establish caring relationships with patients as being the heart and the art of medicine. That's what we're going to be aiming to do over this next few minutes. A little bit about me. Why am I here? Well, I'm a communications specialist, and my niche is actually in performance management and compliances across very many disciplines. And on the left, you will see the different jobs that I've had. Well, on the right, color-coded, is actually how those jobs I had to use information in order to help people to get the best outcomes possible in their work lives. And the thing is, while I was working, I was also volunteering in mental health. And that is really what helped me to understand this connection between the three: thoughts, feelings, and health, because that's what drives performance. And I later on took a course in counseling and psychology, and that helped even more to help me to help other people. During the pandemic, I actually began to volunteer in suicide prevention. And that, of course, is very, very specific to very situational to people. And it was really good to see positive outcomes. So all of that really is related to what you can use as well in your work. Now, yes, I am also a patient of ophthalmologists, so I do bring some personal experience into the presentation today and the topic. The heart and art of medicine actually mean that the heart, the head and the heart are exercised equally. Let me tell you what I mean by an example of something that I saw. I was actually waiting in a room with many ophthalmologists at different stations, and they were all examining their patients. And not too far from me was this doctor. I believe he was a master's student, and he was examining a patient who was about 80 years old. She was a lady. This is from the conversation that I heard between them. Now, as the physical examination completed of her eyes, and she sat back, then she said, I heard her say, "You have been such a nice doctor. What's your name?" And he responded and he complimented her and how fit she was and how well she was keeping herself. And they had a little exchange about that. And you see, because this doctor had used all his head information, all his medical information, and brought his heart into it in his communication skills, his empathy skills, he was able to establish that professional relationship with his patient that helped him to reach all of those 4 bullet points that we want to achieve in covering today, because emotions do affect health, as we have covered earlier. Now, the features of eye examinations are really, really quite interesting, because when a patient goes to be examined by a doctor of some other discipline, the patient can see when the doctor is examining an arm or a leg or a foot, but it doesn't happen with eyes. It's pretty much one way. And so the patient only knows what doctors tell them that they can see. So it is really essential for doctors like you to give very, very specific instructions, very clear feedback, to share the results and implications of assessments, and explain test results where possible. The patient may have come to you with some test results, And of course, the test results are for you to make a diagnosis, but the patient also needs to know, so what's happening with my eyes? And that's where you come in. The findings of examinations can change between appointments, and patients need to understand the parameters so that they aren't terribly concerned or in a negative way about why there are changes. Outcomes of treatments may also vary according to the uniqueness of patients, because patients all have different physiologies and may respond differently. Also, patients are very aware that the eyes are delicate, and any disease or injury may result in irreversible impairment to their sight, unlike when a bone breaks, for example. You know, when a bone breaks, you expect to put it in a cast, and after a certain number of weeks or months, you feel that, well, it's going to be repaired and it's all right, it can function again. Not so with the eyes, and so there is that added concern that doctors need to be very, very sensitive to. Now, there is some interesting information on duty of care and standard of care in February's issue of the MSO Express, and you can see that in the link. You will receive the notes after the presentation, so you will be able to tap into the links of this and other areas that I will be sharing with you. So the doctor-patient relationship then is largely bound on the doctor's empathy skills and the doctor's communication skills. In empathy, the doctor is looking to have insights, understanding, to use active listening in trying to form this professional, insightful relationship with the patient, whereas communication skills are really divided into verbals and non-verbals, and that's another link there that you can look at to read up a little bit more about the relationship between that and the impact your communications have with your patients. Here's an interesting book. There are many equally good books, I'm sure. I just picked this one up to show you. It's called The Neuroscience of Emotion. And this is what is the important part of, you may wonder why, what the impact is going to be. Well, it really has to do with how the brain receives and processes messages. So it's really important to know and to look into as we go along. Now, the benefits of empathetic medical care are that it builds patients' trust, it calms anxiety, it improves health outcomes, there's better adherence to medications. There are fewer mistakes made when there's good rapport and understanding on both sides, and there's increased patient satisfaction, leading to decreased malpractice cases. Here are a couple more links for you to look up in your free time on the role that empathy plays in medicine. There are 5 main steps to empathetic communications, and it's all about building bridges, active listening, empathy. You will notice that these are all non-verbal. And then we go into the constructive feedback, the diagnosis, treatments, and then the friendliness, which involves both the verbal and the non-verbal. And all of these together will add to trust and cooperation. So you see this little picture here. Sometimes you may have 2 patients, and you would have to actually communicate with both of them to inspire trust and cooperation from both in order for you to get the right kind of information and the right kind of outcomes. The impact of communication methods, there's a percentage of impact. Although your knowledge would be communicated mostly in words, the impact of words is really only 7%. Whereas tone, the way we speak, the clarity, pace is almost 40%, but more than 50% of the impact of how we communicate really depends on things like eye contact, smiles, posture, gestures, touches, especially if the patient is non-sighted, if the patient cannot see, then nonverbal communications become very important. Here are some main points of contact with patients, and you would see in the corridor, in the waiting room, you may not identify the patients, but they know that you're doctors. And then in the test rooms, of course, in consultations, and then in areas of procedure, may or may not be surgical, where the patient really relies a lot on the doctor. So let's look at building bridges non-verbally. And this involves your mask, but it's okay. Making eye contact and smiling actually shines through the mask. People can see that. If you can, do wear a name tag, because you are an individual and it makes the encounter far more personal and builds that better rapport. If you recognize a patient somewhere, just nod to those whom you recognize. Again, that just bonds you, creates a better relationship. When it comes to questioning techniques, you'll have lots of questions to ask. So do set the stage first. Whether you're seeing a patient, you can build bridges by greeting the patient by name. Even though you've not met them, you would have a case sheet or a file. And so that's another nice personal touch, to greet the patient by name, make them feel more open to answering your questions. Introduce yourself. If you have a colleague, introduce that colleague as well, so that the patient feels included in the examination, that it is a party examination and the patient's not just an object. Relax the atmosphere with small talk or jokes if you are comfortable with joking, and just something personal. Ensure that the patient is seated to match your vision. Patients come in all shapes and sizes, and doctors really need to give very clear instructions about seat adjustments before you actually start the examination. And then also need to be clear about where you want the patient to look. For example, you could say, look at my left ear, right ear, straight into the light, that kind of thing, just to comfort and reassure the patient that the doctor is saying, I know what you're going through and I'm with you in this. Then you can proceed with diagnostic questions. You can ask about durations, history, and so on in a very friendly and caring tone, so that it does not sound like an interrogation. And you see the picture there of this doctor with such a friendly, open face, so that the message that she is communicating is that we're in this together. I really need to have this information so that I can get the best possible outcomes for you. And so then the patient also feels, yes, this doctor is doing her best or his best for me, and I'd like to offer as much information as I can. When it comes to active listening skills, it's important to listen to understand before replying, however tempting replying may be. Make notes of your findings, good notes, because that file may go to others as well, and it's important to have very, very good notes. And it is also important to note any emotional responses that you sense or you see in the patient, because even though the patient may not realize it, you may spot an emotional response, and that emotion may be connected to a part of the diagnosis at some other time, if not at that time, or maybe even to a recommendation you want to make or you want to withhold, something like that. So the emotional responses really are very, very important. Clarify that you've understood the patient correctly when you make your notes. Check to make sure that what you have understood is accurate. You can ask them if they want to add any other information, because while you were asking questions, something else may have jogged their memory. Give you a diagnosis and suggest a treatment at the end, and then respond to questions about anything you have said. It's quite all right for patients to ask you questions. They're curious. They may want to know how all this is going to help them and what they can do to help you to help them. So that, again, is creating a very therapeutic kind of relationship. Conveying empathy non-verbally, a lot of it is about facial expressions and eye contact and the voice, the tone of the voice, very, very important. So here's a fun group tip that you can engage in. You can video record yourselves interacting with patients and play it back and do some peer support. Help yourselves. When you play back the video, you can comment on each other, how you come across to patients, because we really don't observe ourselves. So this is really very helpful to improve our communication skills. When it comes to relaying diagnosis, treatments, and feedback, especially to those who are sight impaired, then it's the voice, the vocal tone that's really, really important. And here's another fun tip that you can use. You can record your conversations with patients, sighted or not, and play them back. And you know, you might be surprised at how you come across, because we very, very seldom listen to ourselves. And that also, by listening, you would be able to choose how you want to project yourself to patients, and that also helps you to develop your communication skills. Building trust through friendliness, through procedures, well, patients will naturally be feeling anxious and sometimes even alienated, especially with a surgical procedure where they can't see, but they can only hear. So do greet the patient by name, identify yourself, identify the surgeon. It's okay if there are many people in the room, because the patient can hear anyway. So it's great to know that, oh, okay, these people are connecting with me. Assure them of the steps of the procedure and to say, this is what we're going to do next. And you can explain what to expect during and after. You could say something like, we're going to put some eye drops in. This might sting, but just for a little while. Or you could say, you won't feel any pain, but you may feel some pressure. So then that reduces the anxiety, because the patient then knows what to expect. Encourage the patient to respond to questions. You may want to ask the patient questions during the procedure. So encourage them. They may feel stuck, they may feel frozen. So these are things which would help them to relax and would help your procedure as well. Now, what about patients with caregivers? For example, children with parents or people with guardians, could be the elderly who are infirm, the sightless or sight impaired. There could be those who have cognitive or speech impairments and who really cannot communicate, and it's their guardian or parent who's communicating for them. So what do you, the doctor, do? You actually need to give greater emphasis on empathy towards the patient. Let the patient know, I'm your doctor, I'm here to help you to get better or help you to get to the bottom of this. That's to the patient. And to the caregiver, the emphasis would be on your communication skills to ensure the accuracy of information, that they understand what you're saying, the type of treatments, and how they need to comply. You can also enhance collaboration with your patients by encouraging them to join support groups. It can be local Malaysian support groups. It can be international support groups. There's always something going on. There are always many questions being asked. There are always very many developments going on. And the more informed your patient is, the fewer questions you need to answer, actually. Could save you time, and it could help you to relate more quickly with your patient and get to the point more quickly with your patient. Now, emotions and communication skills and their impact on general health. Okay, communicating with empathy actually counters the effects of fear and worry. Seeing a doctor is never something that one feels excited or calm about. So there's always a little bit of anxiety there. And so when you're empathetic to your patient, it calms them down. When anyone is under stress, there are chemical and hormonal reactions to stressful situations, and skillful communication can actually get the parasympathetic system to balance off the reactions of anxiety. And a calm patient actually is a more cooperative patient, and you can actually get better health outcomes, treatment outcomes, because no matter what the stimulus is, it is raising some kind of emotion, which is filtered through the brain. That's where the neuroscience of emotion comes in and is interpreted by the brain, and the brain is giving some kind of instruction to the rest of the body to behave. And here you can look into that little graph later on to look a little bit deeper into how your communication styles can have a great impact on the outcomes that you want to develop in your patients. Now, at the heart of the matter is something very interesting in that we've talked about the patient, but really every doctor has unique traits, experiences, and abilities. And some patients and some situations can trigger adverse internal reactions in the doctor. So making patient care the priority can cause internal conflicts within you. And internal conflicts will impair your judgment and affect your professional performance, because there you're juggling between your head and your heart. So what can you do? You can actually pay more attention, become more self-aware about what your personal triggers are, external triggers, internal triggers, make notes of them, and take a look at how to identify these triggers, what caused them, where they came from, and how you're going to cope with them. This is not something that happens quickly or doesn't happen overnight, but it's progressive, and it's really, really useful for anybody to develop these skills, because it really creates a higher level of professionalism, greater satisfaction in you, because you can sense that you feel that you have done well. How does behavior management influence health outcomes? We have talked a little bit about that. And really, at the core of it is that self-management results in better relationship management. And the little graphic at the top there tells you a little bit more about how the brain processes it. In the longer term, it results in competencies. In the shorter term, it's about performance. So it's an ongoing thing, and it's a very useful thing too. So again, at the core of it all is about our thoughts and our feelings having an impact on our physiology. So in summary then, the benefits to the doctors are on the left, and on the right are the methods that you can use that I have shared with you, color-coded, so that you can achieve better outcomes than maybe you even had imagined. And I hope that you will enjoy using them. Thank you very much for giving me this chance to just touch base with you on this topic. It's a wide topic, it's a deep topic. I'm sure that you will go deeper and deeper into it as you progress. And thank you very, very much indeed. Thank you so much for giving me this chance to speak to you and to share these ideas and tips with you.